First, your mom forgets things like a recent appointment or the name of the newest member of her bridge club. Then she starts pausing on the names of her grandchildren and became irritated at the slightest annoyance. These more significant memory and behavioral changes may be a sign that she's suffering from mild cognitive impairment, a transitional stage from normal aging memory loss and dementia. It's important to diagnose this condition as early as possible, and it's easy to do.
The 45-minute test for cognitive function involves testing different parts of the brain to see which parts of the brain are malfunctioning. Now, we know the temporal lobes involve memory. We know that the frontal and parietal lobes involve calculations. We know that the inferior medial frontal lobe involves judgment. We know that certain parts of the brain are involved in anger and anxiety, and this is reflected in how a person answers the questions. And we can make a composite of which parts of the brain are working well and which parts of the brain are looking like they're getting into some difficulty, and then make the appropriate plan after that.
We devise an individualized program that tries to improve upon the specific areas that the individual has trouble with. There are weekly sessions where she works one-on-one with medical professionals. Part of this treatment plan includes medications that stimulate the brain and can stabilize the brain function for up to 18 months. Then, there are some lifestyle modifications that can help.
Exercise is an absolute must. Nothing stimulates the brain to work better than exercise. And that does not have to be intense activity. A daily walk for 30 minutes at a modest pace fends off Alzheimer's for 3 years. And we tell people that that has to be part of their daily regimen. When a person is exercising, muscles are contracting. Substances go into the bloodstream from the muscles, which go up to the brain and stimulate the brain to work better.
Social activities are also very important. Isolation really harms the brain. We make a point of having individuals see their family members and arrange for social events and outings. Every time a person walks in the door, that's a good day for the brain.
We have them play certain types of games, card games, crossword puzzles, Sudoku, chess, checkers, bridge. Stimulate the brain even if the performance isn't as great as it could be. It's the effort of trying to figure something out that helps the brain to stay in good shape. Sleep is important. The brain may work well with a good night's sleep and may not work well with insomnia or the disorder that we call sleep apnea, which is interrupted breathing during the course of the night's sleep.
The primary goal of treating mild cognitive impairment is to prevent further decline of brain function. We want to start individuals on treatment when they first notice any memory or behavioral problems.
In the world of mild cognitive impairment, where we still have a very functional individual, often it is possible to maintain them in their family life and their work situation for a number of years. And we've even had individuals with mild cognitive impairment who never go on to develop dementia. So this is a crucial point in the sequence of brain function over the years, where we have to find the person who's at this stage so we can keep them in their family life, keep them out of nursing homes for as long as possible.
The earlier we start, the better, and not just for the individual on the cusp of dementia. All of us can see the benefits in memory and mood by staying socially active, exercising, and getting a good night's sleep. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.